Tonic Direct for doctors who care about their patients and patients who care about their health.
So there's a lot of information that we need to get to our patients, and unfortunately time is often against us in a 15-minute or standard consultation.
One of the biggest challenges in Australian healthcare is increasing the health literacy, the health knowledge of our patients. The trouble is, general practitioners' time is fully occupied doing the clinical stuff, and although they want to educate their patients, they just don't have the time.
The sort of things that we love to get across are, general health messages such as diet, exercise, the importance of not smoking, moderate or minimal alcohol intake, and just those ways to actually stay healthy, and a lot of preventative information.
What seems to be good for your heart is good for your brain and helps to prevent dementia. So what are we talking about here?
The main sort of things that we need to get in a more relaxed environment is things like prevention and lifestyle modification. We also want to update them on new information or new treatments or new ways of managing conditions as they change over time. And I guess the other thing is things about chronic disease management that they might not have been focusing on with their diseases.
We would try and fit that into a 15-minute consultation, but often it wasn't possible because you have to deal with the problem that the patient has brought to you today.
Tonic Direct builds patients' knowledge and understanding so that doctors can focus on the clinical aspects of care.
Saving some GP time, but also maybe encouraging the patient to bring things up with the GP they maybe wouldn't normally feel comfortable bringing up. They've seen it discussed in the waiting room on a TV.
Tonic Direct gives your patients knowledge which makes your clinical care more effective.
Probably every couple of days I'd have someone comment on something they saw up there and ask either more questions about it or discuss that they're wanting to start like a weight management program or things like that and what options we have. To us, the benefit that it's had is that it is something that helps them pass the time in the waiting room that actually is educational and isn't drug company focused information, so it's not encouraging them to take a specific medication or path. It generates conversation, so it gets them talking about it, and sometimes it's exposing them to things that aren't their condition but might be a condition that someone they know, and so they encourage that person to come into the doctor. So I think it's sort of it's pitched at just the right level, that it's not too much information, it's not offensive, and it's generating conversation.
Tonic Direct is an invaluable resource that provides patient information on both chronic and acute conditions, as well as lifestyle, well-being and prevention. It bridges the gap between patients and clinicians.
Well, based on what I've heard, I do like the idea of the IUD for not having to take a pill every day.
It's about improving health literacy and patient information so you get the right information to the right person at the right time.